our viewers in Nigeria and all over to Health Guide on Global Television, your number one hub for topical discussions on health matters. I'm Queen Agaba. Hypertension, commonly, I beg your pardon, known as high blood pressure, is often referred to as a silent killer because it can quietly damage your body for years before symptoms become apparent. It's a major risk factor for heart disease, stroke, and other serious health conditions. Despite its prevalence, many people remain unaware of the causes and risk factors that contribute to the development of hypertension, as well as how it is diagnosed. In today's discussion, we will delve into the underlying causes of hypertension, identify who is most at risk, and explore the methods used to diagnose this condition. By understanding these key aspects, we can better manage and prevent hypertension ultimately, I beg your pardon, improving our overall health and well-being. My guest on the program is Jogba Musa, who is a general nurse and a public health practitioner, helping us make sense of what hypertension is. Many thanks for joining me on the program, Nurse Jogba.
All right, thank you, Queen.
It's a pleasure having you. Thank you. When we hear hypertension, what comes to mind is the heart. A lot of people just point straight to the heart, and then we just hear blood pressure and all of that. Can you help us make sense of what exactly hypertension is and how is it different from normal blood pressure?
Okay, I'll use a layman understanding to explain hypertension. Before I go into hypertension, let me talk about the normal blood pressure. I'll use a hose pipe. I don't know if you know a hose pipe. Now, if a hose pipe is pressed or tapped, the water rushed out very well with more pressure. And if the hose is left normal, the water comes out normal. So in normal blood pressure, the blood flows through the arteries normally without excessive pressure. While in hypertension, there is consistent increase in the pressure. So the increase in that pressure is what causes the heart to work more and thereby shooting the figure up, thereby causing an issue to maybe damage organ or other part of the body.
So basically, hypertension is increasing blood pressure, yes, while the blood pressure is just the usual flow of blood.
Yes.
Through the. Oh, that's interesting. So how does family history or genetics play a role in the development of hypertension?
Okay, let me use genetics. For instance, we have chromosomes, the genes, and if one has a parent that one of the parents has hypertension, the offspring, which is the person, the child, when the gene comes together, some of the genes can have just a little quantity of the trait of high blood pressure in it. Now, when these genes comes together, the chromosome comes more together, it can spike it up. That is why sometimes they often refer it to genetic cause.
Genetic causes. I should have asked before asking how genetics actually, affects or endangers one in terms of hypertension. But what are the causes of this increased blood pressure? Genetics happens to be one of them. What are the other causes outside of genetics?
Okay, in a real sense, it does not really have a cause. And what we normally look at is predisposing factor that suggests the cause. Now, one of it that we talked about is the genes. Now, another one is obesity. Now, obesity, what happens in obesity? If one is obese, there is what we call atherosclerosis. That is particles of fat tissue in the bloodstream, that is the blood vessels. Now, if these particles are deposited in the blood vessels, like I said earlier, the hose pipe has a space. If there are particles like inside the host, the pressure that will be coming out will be high. So in obesity, if this deposit of fats are in the arteries, it causes the blood to be high. And another thing is in that obesity is the more body size, more blood. So if one is obese, there is more blood needed to carry out the proper function, thereby putting much work on the heart. So excessive work of the heart and other vessels, it's what causes
Hypertension, one of the
through,
causes.
yeah, obesity. Then another one that have been linked, as research has linked, is smoking. Smoking can cause it. Lifestyle
Changes.
changes can cause it. So if one is living a sedentary lifestyle, it can cause it. Even the diet can cause it. If there's excessive salt in your diet, can cause it and all that. So those are cardinal causes that has been over time seen in terms of this condition.
Okay, I'm particularly interested in the fact that you said salt can, trigger hypertension, cause excessive salt, excessive
Yeah.
intake of salt. But now we hear a lot about mental health, stress, particularly this age and time. People talk about workplace stress and their mental health, and it's become a theme. We can almost link it to hypertension and, high blood pressure. Does that in any way influence or trigger hypertension in a person, stress and mental health?
Yeah, stress and mental health has also been linked to high blood pressure. Now let's look at stress. When one is stressed, the body releases a hormone called adrenaline and cortisol. Now, this adrenaline, when these hormones, when they are released, they causes the flight and the fight to activate. When this activates, it causes the heart rate to move faster. So when the heart rate moves faster and it continues consistently, it's going to cause hypertension in long run if it continues. Now, another thing is depression. Of course, we all know if one is depressed, it affects the activities of daily living of that individual. So if you cannot function properly, you are putting more work on your heart. So that is depression and anxiety. If you're anxious, always always thinking about what's the problem that does not really exist. I used to tell my friends that it's better to live in the moment than to live in the future. You are expecting for instance, you want to pay your house rent in February next year. You are thinking about it now. So it's actually not, you have to be calm. You don't need to be anxious all the time. Another thing is post-traumatic stress syndrome.
Okay.
Now, this, for instance, if something terrible had happened to one before, and the person keep bringing that up, it keep coming up in almost every day of the person's activities. Now, it affects the heart. Because the heart, anytime, if it's something that is bad, anytime you remember it, your heart will beat faster. And if it continues, like I said before, it's a consistent pressure. So if this heart keeps working excessively consistently, it's definitely going to affect and going to cause hypertension.
Okay, Nurse Jogba, let me ask, is there a specific time frame, say, if you continuously put your heart under pressure in terms of mental health, stress, or even anxiety or PTSD? Maybe you've had PTSD experience, that's post-traumatic stress disorder, and then you're thinking about it daily. How long is long enough for you to develop hypertension? Is there a time frame, say 1 month consistently, you keep putting your heart under pressure, or you keep thinking about things that make you anxious, you're going to develop hypertension? How long? Or does it just, what's the time frame?
Okay, there's no time frame to it. How you can check if you have hypertension is when you keep checking your blood pressure, it keep rising consistently, then you can be considered. Like the normal blood pressure is 120 over 80 millimeter mercury. That is the up, the systolic, and the down one, the diastolic. Now, if the blood is elevated, if your blood level is elevated, you'll be having a figure like 121 to 129. And while the diastolic, which is the one under, is still 80 or less than 80. Now, another category of it is hypertensive stage 1. Now, the stage 1 is when the blood pressure is above 130 to 139. That is the up one, the systolic. The down one is above 80 to 89. That is stage 1. Now, I'm trying to explain on your point whereby, like I said it's consistently, if it keeps increasing. Now, this stage 2 is when the figure is above 140, that is the systolic, and the what's it called, the diastolic, which is the under, it's more than 90. That is stage 2. There's what we call hypertensive crisis. Now, hypertensive crisis is when the upper one, which is the systolic, is over 180, and the diastolic, which is the one under, is 120. At that point, it's crisis.
Of emergency.
Yeah.
Okay.
You have to, if nothing is done at that point, that person has a 50-50 chance of dying. So there's no time frame. It's just for you to check. As you are checking, you are monitoring the figures. So if the figures keeps increasing, if it keeps fluctuating, it might be possibly your activities or something. But if it keeps increasing, it's cause for concern.
Okay. Usually when you talk about blood pressure, people assume that you must have been of a certain age for you to be concerned about blood pressure. Say you're not up to 40, you should not be concerned about, or 30 or thereabouts. But these days we've had cases, you go to the hospital, you have children who are diabetic, who have had cases that are considered adult, diseases or adult concerns. How old should a person be before they start looking out for their blood pressure?
Okay, research has shown that from 3 years old.
Oh, really?
Yes. Now, there's what we call routine check. In health insurance, we call it annual medical check. Now, you have to keep checking, especially those that have history in their family. You have to keep checking from 3 years. So long you live, or how do I put it, like, if you are still living, from 3 years till the person dropped dead, you have to be checking. You can't stop. And the fact that you have not gone to the hospital for the whole year, that's why the insurance introduced that annual medical check. So you have to do the annual medical check to actually know the state of your health. So from 3 years upward, that is when you can start checking for high BP.
Oh, really?
Yeah.
You can imagine. It looks like 3 years is too young.
Yeah.
But these days, no age is too young to be concerned about, But what are the key indicators that a person might be hypertensive? How do you begin to, look out for yourselves in terms of hypertension, symptoms, signs to look out for? Okay.
Some of the signs to look out for is consistent headache, frequent headache. Is one of it. Some people may come up with nose bleeding time to time. Some may have dizziness, fainting, and some may have blurred vision or double vision. Like, okay, you are seeing, for instance, I'm seeing the camera in two places, one camera in two places, or I can't see very well. So if you start having those signs consistently, you have to go and check yourself. So in a nutshell, blurred vision, double vision, consistent headache, nose bleeding, and co.
But is there a possibility of, having high blood pressure or hypertension without having any of these symptoms?
Yes, 100%. That is why it is called a silent killer. There are several cases where people drop dead and getting to the hospital, some autopsy will bring it that, okay, it's high blood pressure. A lot of people have seen cases whereby people are not even aware that they have this kind of, because we go for health sensitization, and at that point we do basic check. Sometimes we find out that some people are 200, some are 180, and they're not even aware they're running their daily life. So it's very much possible, and that is why it's a silent killer. Yeah.
So are there correlations, hypertension and diabetes, hypertension and other diseases?
Yes.
Particularly diabetes.
Yes, there are correlation. We have what's called primary hypertension and secondary hypertension. Primary is the one that most time we don't even know the cause, while secondary is one that is being triggered by a a particular disease condition or something. Now, we look at if we want to look at it, like I talked about obesity. Then there's what we call insulin. It affects insulin. If the insulin level is affected, definitely it's going to tell on the kidney, and the what's it called?
Diabetes.
Diabetes will come up. So they are intertwined together, and once one is affected, if it's not properly taken care of, it's just like a car. If one part of the car is affected, you don't work it, it will affect other parts. That is how the body system is. And that's why it is called a system. Every organ has its own function, and coming together is a system. Once one is malfunctioning, especially the heart works every now and then, even when you are sleeping. So if the heart is affected, definitely it's going to transcend to other part of the body.
Interesting. The heart works even when we're sleeping.
Of course, yeah.
All true. We know that, and so we have to be particular about checkups. But are there any lifestyle changes, things that we can do to help prevent hypertension?
Yes. First on the list is lifestyle modification, which we can't rule out diet. Like I said, you have to reduce your salt, take more of vegetables and fruits. Another one is smoking. You have to stop smoking. The person has to stop, an individual has to stop smoking if you don't want to predispose yourself to a hypertension. Another thing is you have to reduce the intake of your alcohol. We can't say people shouldn't take. You have to reduce it to the barest minimum. And you have to time take a rest. Go for relaxation, go for vacation to cool off the pressure at work, pressure in fact, even if you are married, sometimes you can even say, okay, I want to just go and have one day off with my parents. Let my husband or my wife be with the kids. And once I come back, my wife can go and do the same. At least let it be that at every point in time, you are enjoying your life. Enjoying your life does not mean that you should live it recklessly. You have to work on dietary very, very well, because it's one of the major things that have been linked to it in this part of the world. So we have to work on it. And our mental health, of course, we have to, if possible, if you cannot afford mental health classes, we can read about mental health and especially depression and anxiety, on how to manage it, and PTSD, how to manage it and all that. So, yeah.
Oh, thank you very much, Nurse Jogba Musa. You have, really taken us through what hypertension is, the risk factors, and prevention. We'd definitely like to have you again on the program. Hope you grant us that.
All right, yes, sure,
audience.
Yeah.
Thank you. If you just joined us, this is Health Guide on Global Television, and we'll be speaking with Nurse Jogba Musa, who's been taking us through what hypertension is and how to prevent it. Well, this is where we draw curtains on Health Guide. Make sure to follow us same time, same station for another interesting episode of Health Guide. Don't forget to follow us across all social media platforms using @Global TV NG and other handles now showing on your screen. I'm Queen Agaba. Thank you for watching, and see you again.